National Hospital ge khidmat ka gole ko tong mi ba arun kuri genani. They are on today's special broadcast where we explore the forefront of medical innovation and patient care. We are honored to have with us Dr. KARTHIK Damodharan, the esteemed Director Vascular and Interventional Radiology at MIOT International, India. Dr. KARTHIK brings with him a wealth of expertise in cutting-edge medical procedures that are transforming lives around the world. In this episode, we will dive deep into incredible work being done at MIOT International, which has gained the trust of patients from over 130 countries. We'll also discuss the groundbreaking genicular artery embolization procedure and how it is revolutionizing vascular health. So stay tuned as we uncover stories of recovery, innovation, and advice to optimize your health. Welcome, Dr. KARTHIK. My first question is, tell us a little bit about yourself and your association with MIOT International India.
Thanks for the question. Very good morning to you, Inayat, and thanks very much for having me on the show. And it's great to be in the stunningly beautiful country of Maldives. A bit about myself, I'm Dr. KARTHIK Damodharan. I'm working as the director of the Department of Vascular and Interventional Radiology at MIOT International, which is based in Chennai. Mm-hmm. So I did my medical schooling in the esteemed Madras Medical College in Chennai, and after that I did my postgraduate training in the UK. So I trained in internal medicine, I did my post-graduation, and then after that I did my training in radiology and super specialized in interventional radiology. And after that I went to the US for a year of fellowship training. And after that, I worked as a consultant and a senior consultant in this specialty for nearly 15 years. I worked in the UK, Singapore, and then finally I moved back to India. And since I've been in India, I've been working with MIOT International for the last 4 years. Can
you tell a little bit about the MIOT International?
Definitely. So MIOT International is a quaternary care multi-specialty hospital based in Chennai. And it's a 1,000-bedded hospital, and we treat a lot of highly complex patients with medical problems. And the reason being, we are a 1,000-bedded hospital with 250 full-time specialist doctors working at MIOT with very high-grade quality infrastructure we have. And MIOT started 25 years ago as a very small 70-bedded hospital providing treatment for orthopedic patients and trauma patients, and slowly, because of the trust people had in MIOT and the quality of care we provided, slowly expanded, and we have 63 medical specialties across all the medical fields, and we provide, as I said, high quality care to these patients, and patients from nearly 130 countries visit us regularly for treatments at MIOT.
As I mentioned before, people from 130 countries visit MIOT for their treatments. What's the reason? What's so special about MIOT and their treatments?
Yeah, MIOT is unique, actually unique in one of many ways in India, because firstly, because we are a quaternary care hospital, we have 63 medical specialties. We provide treatments from A to Z, as in from the patient comes in to have the tests to diagnose what exactly their problem is. Very important to find out what exactly they're suffering from, and then we devise a treatment plan for these patients, and then we even do rehab, as in once the treatment is over, they need to get back to their normal life, and we do from the beginning to the end of treatment. So that's one good thing, because we have all the specialties in-house. We can do everything from A to Z at one place. Second thing, as I mentioned earlier, we have 63 medical specialties with 250 full-time doctors who only work exclusively at MIOT. Like most hospitals or most places in most countries, the doctors work in different hospitals. So in the morning they are in one place, in the afternoon they have gone to another hospital, but not in MIOT. They're all dedicated to MIOT. So anytime the patient needs anything, their own doctor is available readily to provide the treatment, so the patients get the better outcomes. And lastly, we also have this multidisciplinary treatment concept. So when a patient comes, he doesn't have one problem. He comes with one major problem, but he has other issues surrounding it. So we involve all the specialists with regards to this patient's care. So the patient gets an individualized plan for this patient himself. So they get the best outcomes for these patients.
You're the director of the Interventional Radiology Department. What is interventional radiology and how does it benefit the patients?
Right. So we all heard of CT scans, ultrasound scans, where radiologists look at these scans and they can tell you what exactly is wrong with your body without opening you up. And intervention radiology is a further specialization in this field, where we can not only look at and find the problem, we can also treat these problems just through a tiny hole in your body without opening you up. Where these treatments used to be done by surgery, where they open you up to treat the problem, we can now do these treatments through a tiny hole, because we can see where exactly the problem is and deal with the problem. So by this way, it's a very revolutionary treatment, because we don't have to open you up, we don't have to give you general anesthesia, and patients can recover very fast within a few days of the treatment. So we can also treat problems from head to foot with this specialty. So to name a few, we offer treatments for patients with thyroid goiter. A lot of people have thyroid swellings in the hand, and we offer radio frequency ablation, where we just insert a needle through the from the skin into the thyroid gland and just burn this nodule. So they don't need to have the thyroid gland removed. You just have this treatment, and then next day they go home, and the thyroid nodule shrinks, and then this nodule is not seen. So other treatments we offer for liver cancer, again without opening up. For fibroids, a lot of women suffer from heavy periods due to fibroids, and this can be treated without removing your uterus. They can preserve their fertility but have that fibroids treated through a pinhole. And we do treatments for varicose veins. We do treatment for patients suffering from blocks in the blood vessel in the leg, which happens in diabetes very commonly. They have wound ulcers, we don't heal for a long time, and you open these blood vessels, these wounds heal, and they save the leg, because otherwise they end up with losing the leg, which is a very common problem. And of course, latest we're offering this treatment for knee pain called genicular artery embolisation, which helps to relieve the pain within a few days of treatment without having to undergo surgery.
That sounds very promising for all the people who are suffering from knee pain currently. So genicular artery embolization. This is the first time I'm hearing about this term. Can you explain to our listeners what a genicular artery embolization is?
Definitely, I'll be happy to help. So basically, just to go back, the knee pain is a very most common orthopedic problem we see in our hospital all over the world. And this is due to a condition called osteoarthritis, where as you get older, your joints get worn out, and then you have severe pain when you walk. And to get an extent that some people can have severe pain just to walk from their bed to the washroom, they can have severe pain as they get older. And we are seeing more and more of this problem even happening in younger patients now, as young as 40. And previously the only treatment used to be to have an operation where they cut open your knee and replace the joint. That's a major surgery, and not many people are willing for this. Or some people, when they get very old, they're not fit for having the surgery, not safe to do the surgery for them. So for them, there is no other treatment option but just to take painkillers or apply ointments and massages, which only give temporary relief. But now we have this treatment where we, through a pinhole access in the blood vessel in the groin, under local anesthesia, without giving anesthesia, we can get into the blood vessel supplying the knee joint, and we block the blood vessels which are causing the inflammation inside the joint, and the pain gets completely removed within 2 days of treatment, and the patients are back to their normal life. Suddenly they can walk without pain, and they can do all their activity without pain. So it's a great revolutionary treatment, and we found that it's giving great relief to patients in India, and we thought that we should create awareness about this condition and this treatment possibility for all the other people. That's why we're here in Maldives.
Here in Maldives, the community, there are a lot of people who are suffering from specifically knee pain and arthritis problems and issues. So most of them, they don't proceed with the surgery because it takes a lot of time for recovery. So how does the recovery time is cut off in the genicular artery embolization, and how does the procedure go on? Can you explain?
Sure. As I briefly told you, we just do it, we give an injection in the groin, just like patients having heart angiograms done, coronary angiograms, we just give a small injection in the groin to numb the area. Then we put a tube into the blood vessel, and in the x-rays in the cath lab, we see the tube and push it into the blood vessel supplying the knee joint, and we inject dye to find these newly formed blood vessels which are the cause for the pain. And we block these abnormal blood vessels, we block them, and the normal blood flow to the knee joint is maintained. And this helps to relieve the inflammation inside the joint, and the pain gets better. So this treatment, normally when you do within a few hours after treatment, patient is up and about walking, and 2-3 days the pain is completely gone. They get almost good relief of pain, and they're very happy that they can suddenly get back to their life, because if you're not moving, you don't have your life. So everything you need to move, even if you go to your washroom, you need to move. So this really helps to free them and get their life back.
Can you share a few case studies where genicular artery embolization procedure, and also how the recovery procedure was for the patients?
Yeah, Sure. Sorry, I didn't mention about the recovery. So as I told you, it's a very, very short recovery.
Yeah.
Patients are walking a few hours after surgery, the procedure itself, not surgery. And the next day we discharge them. Usually if they are local patients, they go home even the same day.
Even if it's the knee?
Yes, yes. Because we only put a small, tiny hole in the groin, and then that's all. There's no stitch. There's only local anesthesia. So they just have a plaster and they walk off and they go home. So the recovery is very, very short compared to surgery. And regarding success stories, we've had lots of success stories where we had lots of happy patients having had this treatment. And I can tell you about a patient from Maldives who had this treatment. There's this young lady who's 40-year-old, and she had this osteoarthritis in the knee because she had unfortunately had a road traffic accident a few years before, and she had operations on her knee, and because of that, the knee get damaged over time. And now when she came to us, she was on a wheelchair for the last 5 years. She's not been walking. And she's a mother of 4 children. And you can imagine, a mother of 4 children, there's so many things to handle, and one person cannot handle. And she was like wheelchair bound, and she needed help even with her own activities. And her husband had to help her out with her own activities and also the children. So she was feeling very bad. And she came to us asking for knee replacement surgery. And our specialists, we saw her at Miyot, and then we told her she would need knee replacement, but not at this age because she's very young for knee replacement. So we offered her this genicular artery embolization procedure after explaining to them about this. It's a fairly new procedure, but we explained to them, yes, this will help, definitely help. And they had the procedure done, and within a week, she's walking. So she's just not been walking for 5 years, and she was literally in tears that she can walk again and she can take care of her children, and her husband was very happy. So that's a sort of dramatic improvement you can get with this procedure. And other end of the spectrum is a patient who came from Tajikistan. Again, she came for a knee replacement. This lady was 80-year-old, and she had really bad knees, and then she came here because Miyot is a very one of the top orthopedic hospitals in the country, in India. And so she came for knee replacement here, but when we sort of did all the tests for her, we found out she has heart problems and she can't have surgery. Now she was very dejected because she came for surgery to have a knee pain relief, but she couldn't. So again, we offered her genicular artery embolization, and within a few days her knee pain was gone, and we did treatment for both her knees, and she again was walking. And her son was very elated because she's always seen her mum very active and moving around, and now she's suddenly bed bound, and now after this treatment again she's walking again without pain. So that's a sort of dramatic impact when you have this treatment.
So people who cannot go under anesthesia, this is a really good procedure.
Exactly. People who don't want anesthesia, or they don't want anesthesia, don't want surgery. Some people are very afraid to have surgery, they don't want surgery. Or some people are too young to have surgery. So we see patients like 20% of patients who come to Miyot for knee pain, they need surgery, but they're not willing for surgery for some reason.
For the recovery time as well.
Exactly,
right?
recovery time as well.
So I was wondering if a patient has done knee replacement or another procedure earlier, can they still go for this one?
Yes, we will evaluate them and see them why the pain is happening, and the knee joint is the new knee joint replacement is good place and everything. Because if the joint replacement is some issue, then that needs to be fixed. But if the joint replacement is good and still they're having pain, yes, we can offer this treatment for them, so they do have a chance of getting pain relief as well.
Everything you have told so far is very promising to many listeners who are listening right now. What advice would you give to the patients to optimize their vascular health?
Okay, this is a very important question. This is about prevention because vascular health relates to the blood vessels, and blood vessels are what supply your blood to all your important organs and nutrients to the organs. So if there is a problem with the blood vessels, then the organs get damaged or having some issues. So very important to maintain your vascular health, and it can just be done by very few simple steps. First is your diet. Make sure you eat a lot of